Thank you.
All right, while waiting for our speaker, I just want to pop a question in the group. We have seen the theme, the topic of this event tonight. So while waiting for our speaker, I would just like to ask a very quick question, before the speaker come in. Okay, Mr. Wale, I can see you're ready for us tonight. Okay, just a few minutes before you start, sir. I would like to ask, this is Elizabeth Ifelowo. I'm sure I got the pronunciation correct this time around. Miss Elizabeth, are you there, ma?
Yes, I am.
All right, please, can you just, before the speaker, starts his presentation tonight, can you just tell us something sweet that you know about data and healthcare? Just a brief, sweet information about data and healthcare.
Okay. First off, I believe data is a very basic thing. We collect data whether or not we know it. And I'm a nurse, so from my interactions with patients, vital signs, basic information, that health history and all of that is data, and all of those are needed to make informed decisions concerning the patient's treatment and concerning healthcare generally. Data provides insights into problems and problem solving. And
wow,
yeah, that's what I know about data.
okay, I know you still have more for us, but let's just keep it. I believe our orientation and knowledge about data and its application in healthcare is going to be fine-tuned tonight. I know Mr. Wale Ademo is fully loaded and ready to dish us stuffs and to enlighten us, broaden our horizon of knowledge on what data is and its application in healthcare. Other than the basic vital signs and some other patient-related data that we gather, there are still some specific significance of data, especially when it comes to creating innovation and providing solutions to healthcare challenges. So I would like to open the floor now for our speaker, Mr. Wale Ademo, the CEO, ZACRAC Limited, a data science and data analytics company. Welcome, sir. You can have the floor, sir.
Hi, everyone. Good evening. Can you hear me? Please say hi in the chat box if you can hear me. Hi.
Yes, I can hear you.
Great. Good I'm happy to be live on this program, and I'm happy for the opportunity to talk to healthcare professionals about the role of data in healthcare. My name is Wale Ademo. I'm the founder and CEO of ZACRAC Integrated Limited. So we are a data science company with a singular goal of helping individuals and organizations make smarter decisions using data. So we do this in a number of ways. And one of it is data science and analytics training, where we teach people, individuals, corporate organizations, on the benefit of data and how they can use data to make better decisions in their organization, or to improve their processes, or solve whatever problem they might be having in their organization. And we also help individuals and organizations collect data in form of a market research. For healthcare organization, we've done quite a number of healthcare studies, pilot studies on new medications, on drugs, patient studies, quite a lot of projects, both within and outside the country. And in my years of experience working as a data professional, I have come to realize that data cuts across nearly every field, every aspect of life. And healthcare is very peculiar because, of course, everybody have something to do with healthcare. Healthcare is one sector that runs on data. Everything that is being done in this sector is based on data, at least to a very large extent, from academic studies, clinical trials, drug development, vaccine development, disease monitoring, healthcare management. Everything about healthcare, to a very large extent, runs on data. So there is a convergence between healthcare and data. Both of them are not separable. Whether we know it, whether we like it, whether we even acknowledge that healthcare professionals are most times by default data professionals, right? We generate a lot of data, we collect a lot of data, like Ife rightly said. So we collect a lot of data every day, from vital signs to medical history to patient monitoring. To a lot of data is being collected, but there's no healthcare without data. You can't just outrightly see a patient that tells you, or that walks into your clinic or your hospital and just tells you, I have headache, right? Please, can you hear me?
Yes, following very closely, sir.
Great. So great. So a patient can just walk into your clinic and just tell you, I have headache. Then you go straight and administer a treatment. You begin to ask questions. Have you been stressing yourself? Do you take alcohol? Do you smoke? All those questions you're asking is a form of elicitation. You are trying to get some data from this patient. Now, based on the responses, based on the data provided by this patient, then you can begin to streamline your options. Okay, if you do this, then this is likely to be the cause. If you don't sleep well and your head is aching you probably don't need a medication. You probably need to rest. If you take alcohol and you smoke, then this might be this. So all of those things, you are simply using data, whether we understand it in that context or not. And of course, when a vaccine, for instance, a COVID vaccine is being developed, they don't just mix stuffs together. They collect data. When they mix stuffs together, they test it. When they test it with data. The result is data. So if this is greater than this, then this vaccine can be administered, for instance. So the application of data in healthcare is unlimited, is endless. Either in development of even medical equipment, in development of braces, in development of life support system. So all of these systems, they all run on data, right? So there's no healthcare without data. So our conversation this evening is more or less like a sort of sensitization. We'll be talking about some specific areas where data is applicable in the healthcare. Then we'll be having more like a conversation. So there will be questions and answers. I'll be sharing some of my experiences, some of the kind of projects we've done and things like that. So that is just a very short bio about me. I'm a data evangelist. I'm a certified data professional. I studied computer science, and I'm just trying personally, and we as an organization, we are just trying to help more organizations in different sectors get into the data tree and make smarter decisions using data instead of guesstimation or emotional decisions. When it comes to healthcare, for instance, right? Instead of somebody just walking to a pharmacy and telling the pharmacy, I have malaria, no test was conducted, no data to back it up. and of course, medications is being applied. So we believe that is not the right thing. That's not the right way to go. So data actually is going to limit a lot of casualties and damages we're having from a lot, maybe things like wrong wrong prescriptions, overdose, and stuff like that. So are we good to start?
Go ahead, sir.
Yes, please.
All right, thank you. So the first point, and which I believe is one of the most common, one of the most critical. Thank you, Emmanuel. So one of the most critical and most common convergence between data and healthcare is patient monitoring. So if you look at my screen, you're going to see a patient on the bed. There are a lot of machines around. There is a nurse, or I assume that's a nurse. I don't know. Please pardon me if I'm wrong. So there is somebody reading something on the device. So all of these machines are connected to that patient. All the machines are collecting some kind of data from these patients, from the patient, from blood pressure to pulse to a lot of medical data are being collected about this patient. So these machines are just being used to track maybe the receptiveness of this patient to the treatment or medications they're applying. And if you look at the screen, you can see number, you can see 136, you can see 100, you can see 28. All these stuff, they are all data, right? And I'm sure that when maybe the 136, the first data point, either drops below a certain number or goes higher or goes above a certain number, it has some meaning. So based on this data, the doctors or the medical practitioners attending to this patient, they know what to do per time. So the more data a medical facility can collect or can have access to, of course, based on the equipment and the machines they have, the better. Can you give us a full screen projection? How about now, sir? Is it better?
Yes, it's better now.
All right. So the more equipment maybe an hospital or a clinic has, the better the quality of healthcare that can be provided. Now, this better is relative. Now, it's not really based on maybe they are competent medical practitioners or they are competent nurses, competent doctors, experienced doctors, and the likes. So no matter how qualified, no matter how experienced, no matter how competent these medical practitioners might be, the doctors, the nurses, the caregivers, all of these people, the quality of care most time is dependent on the volume or the quality of data that the medical practitioners can have access to about the patient. So without that data, a lot of decisions cannot be made. Without the pulse, for instance, you can't know if a patient, or without the blood pressure, you can't maybe begin to talk about things like if a patient have diabetes. There's a very strong correlation between a lot of data points. And the more access, the more data that the medical practitioner have access to, the more informed decisions, right, can be made in terms of what to administer, in terms of whether a surgery should be carried out, in terms of what medication, right, will be more appropriate for a certain patient, a patient with diabetics, for instance, and a patient without diabetics that have the same, both of them have the same ailment. So I strongly believe that data about diabetes might even be something that is going to change or influence the medication or the kind of prescription to be given at all. So a patient with high blood pressure, for instance, that is treating a certain condition, and another patient with a normal blood pressure that is treating the same or that has the same medical condition, that data about the hypertensiveness to a very large extent is going to influence a lot of things, from the diets to the lifestyle recommendations to the kind of prescription to the dosage that will be given to that person. So there's really no healthcare without data, and to a very large extent, right, the quality of care hinges so strongly on the quality of data, the volume of data, and the ability of the medical practitioners attending to a patient to make sense and make use of those data. So understanding and the ability to interpret the data makes all the difference most times in whether a patient will survive, in whether a patient is not going to survive, or how quick or how well a patient is going to recover. So if there are no data, for instance, there are no data about allergy, and you are just applying you are just prescribing or applying a certain treatment to a patient. So instead of getting result A, because you don't have data about that patient's allergies, then you might be getting another thing entirely. So a very typical example is chloroquine. So some people react to chloroquine, and chloroquine is probably one of the most common, most popular, at least in this part of the world. So as a medical practitioner, if you don't know that, okay, this certain patient A reacts to ABC, you don't have that data, or you have that data, you're unable to interpret it. So your choice of your choice of prescription, your choice of care might not, most times, might not have the expected results. So patient monitoring is one of the biggest areas that data can be applied, or data is being applied in healthcare. So decisions are made based on data. This patient lying on the bed, probably unconscious, everything that is going on within the patient body can be represented or is represented on those machines. Now let's assume that the medical practitioners or the person that is in front of this machine is unable to interpret, or when a certain thing is supposed to drop, is increasing, but this person is not able to interpret it. So there might be chaotic administration of maybe medicines or processes that shouldn't even be in the first place. So patient monitoring is key. Apart from data being used for diagnosis, being used for to prescribe and the likes, monitoring the effectiveness of your prescriptions most times hinges on data, and the ability of a medical practitioner to understand and interpret and make sense of those data to a very good extent is going to influence the choice of care, the choice of prescription. It's going to help you to know, okay, whether to take a certain patient off a medication, or whether to administer to a certain patient some kind of medication. So based on data. So the more you collect data, the more you use data when you are monitoring a patient, then your decision per time, as per what to do, as per when to do it, as per to what extent to do something for or to that patient or on that patient, right, is likely to change. So instead of, assume a scenario where a certain medical practitioner is just telling a patient, okay, take 2 tablets of this for 3 days or for 3 weeks, for instance. Within those 3 weeks, data is not being measured. At the end, it's not being collected. At the end of the 3 weeks, there's no data collection, or either the patient doesn't show up, or the patient shows, or there's poor data collection by the medical practitioner. So I can tell you that from experience, you really can't say whether your prescription had adverse effects or have the expected effects on the patient. So this is one of the key ways, one of the key areas that data and healthcare have a very strong convergence. There is no patient monitoring without data. So please say I, or just drop something on the group if you are following.
Following, sir.
All right, thank you. So the second point is in the area of disease prevention. So tracking and disease prevention is probably one of the biggest things that most of us are used to, thanks to COVID-19 pandemic. So if you remember vividly, during the pandemic, every day they used to release something, number of cases, number of deaths, where this, where that, and the likes. So disease prevention has a whole lot to do with data. Without data, everything we are doing to prevent maybe an outbreak, to prevent the spread of a certain disease or virus, or maybe virus, as the case is with the COVID, or bacteria, is just guesswork. When the whole COVID started, how did we know COVID has entered Nigeria? A case was reported. That is data. There was contact with another person who got more data. Those people began to spread. They began to multiply. Somebody touched somebody, somebody coughed, somebody took in that droplet, and it spread, and it spread, and it spread, and it spread. So without data, we really cannot track the outbreak of a disease anywhere. Say in Lagos, for instance, let's assume we don't have data about COVID. We don't have data about somebody that traveled from the UK, somebody infected with COVID that traveled from the UK, that traveled down to Nigeria. We don't have data about that person, for instance. Nobody keeps any record. And that patient goes to a very populated place like Lagos, right? And begin to spread that disease. It's most likely we're not going to know that there's a disease outbreak. We're not going to know, okay, that COVID is now in Lagos. And if we don't know, we can't start to put in measures in place to curb the spread of COVID-19 in Lagos. So of course, if we can't track it, we can't prevent it. You can't improve or you can't measure. So tracking and disease prevention, they are just very, 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 very vital. It's one of the biggest applications of data to healthcare. So tracking the spread of the virus is purely based on data. So most of those numbers were not just conjured. Most of those government policies that, okay, put on your nose mask, is not because maybe a certain government want to sell nose mask, or they want to sell sanitizer, or they want to make us not comfortable, right? Most of those decisions were based on data. If you can see from data that, okay, 2,000 people are now infected in Lagos, and if you put that 2,000 into some model and apply a function of time, right? 2,000 people carrying this virus within a function of time, and you apply a rate that, okay, if these people are mobile, they go to work, how many people do they come in contact with per day? If they come in contact with people per day, on the average, say 10 people per day, 2,000 people, 10 people per day, within 3 days or within 1 week or within 10 days, we can have an outbreak as high, or we can have infected people as high or as much as 2 million people. So based on this data, we can begin to put policies in place that, okay, are we going to do a lockdown? Are we going to do a curfew? Are we going to ask people to go on nose mask? Are we going to ask people to start using sanitizer? Are we going to ask people to start going to public places? Are we going to tell people to stop going to church, to stop going to certain places like clubs, like cinemas, like restaurants and the likes? So all of these decisions, all of them are just based on data. So they plot some of these things, though some of them are predictive. For instance, it doesn't mean when they were building those models, we have 2 million cases. So by using hypothetical data, dummy data, that, okay, if 2,000 people are infected at maybe a certain rate of spread and within an hypothetical time, in 1 week, how many cases will we have in Lagos? So in order for us to prevent the spread of that certain disease or that certain outbreak, data play a very, 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 very strong role. So without data, we can't have preventive measures. If we don't have preventive measures, it can start from epidemic, and before you know, eventually we landed in pandemic. So let's say, for instance, in some countries, data has shown it that if certain countries in the world, if they had adopted some measures, or if they had made some data-driven decisions, right, either about locking down their economy. In fact, Nigeria is a very good case study. So there are speculations, there are arguments out there that if we had closed our border earlier, maybe, or just maybe, we would not even have COVID, or the case would be minimal, right? So some of these things are based on, they should be based on data. They should not be based on sentiment. They should not be based on how somebody feels. They should not be based on political affiliations and ideology. And a lot of Western countries too, right? Say US, for instance, the death rate was so high. These guys were using they were building a lot of models during the pandemic. Different models saying that, okay, if this goes on for another 1 month, 2 million people might die. Some models are even saying that if this pandemic is not curbed within a certain number of, it might even lead to maybe a termination of some of populace in some countries. And there were even predictions initially that there were going to be body bags on the street of Africa caused by COVID. That may sound a bit political. That may sound a bit too strong a statement. So, but if those statements were based on data, then I think, for whatever reason, so for reasons we don't know yet, which I also think if we continue to do our research, we're going to find from data why we don't have all of those massive predictions and projections about the spread of COVID in Africa. So there's no tracking and disease prevention. We can't actually track what we can measure. We can't measure something that we can't collect data about. So tracking and disease prevention is one of the biggest ways, it's one of the biggest application of one of the biggest applications of data in healthcare. And COVID-19 seems to be a very strong case study that everything about COVID, even till now, a lot of countries are still, for instance, UK, they are still maybe adhering to some measures, adhering to some stuff, just based on data, right? They are finding new variants of COVID. They are collecting data about these variants. They are studying them. They are studying their features, their characteristics, whether they react to high temperature, whether they react to their reaction to alcohol, their reaction to cold weather, whether the sunlight and all of these parameters have an influence or have an effect on the spread or the effectiveness of those variants of COVID. So tracking and disease prevention, to a very large extent, 90 or 95% or more, is dependent on data, right? Are we still together? Are we together, please?
Yeah, yes, we are together.
All right, thank you. So apart from tracking and prevention, one major way that data is being used or can be used in healthcare is prediction of outbreak. It's one thing to react, it's one thing to track something that's happened, it's one thing to try to prevent something that's happened, right? There is another thing to predict. Please, can you mute your mic? Okay, somebody has a question. Please just mute your mic. We're going to have time for questions and answers. Okay, great. I think all the mics are on mute now. So prediction of outbreak is one of the biggest ways that data is being used in healthcare. So daily research, a lot of researchers are working not on diseases or outbreaks that we already have. A lot of studies are ongoing about, okay, what might be the pandemic of the next decade? Are we likely to have another COVID? Are we likely to have another maybe major outbreak like Ebola, like cholera, like SARS, and all of those stuff? So I feel like this is probably one of the biggest breakthrough of data in healthcare. Healthcare can be preventive, right? We can be using data to either monitor a patient, to track the spread of a certain disease, to control or regulate the spread of a certain disease, to develop measures, healthcare measures. So, but something that can predict maybe outbreak that would happen in the future, I think that is likely maybe one of the biggest breakthroughs of healthcare, of data and healthcare. So based on these predictions, we can begin to put measures in place before they even happen. They can begin to develop vaccines. They can begin to maybe roll out policies. They can begin to roll out advice. A lot of measures can be put in place, for instance. So this is often carried out using predictive models. So from samples collected from animals, from human waste, from animal waste, from different places, from rock, from habitats of bacteria, habitat of birds, of animals, and all of those stuff, right? The data collected from all of these places, or some of these places, they can be used to predict if we are going to have an outbreak in the next 10 years. Are we going to have another epidemic? Are we going to have another pandemic? Are we going to have an outbreak of maybe a certain disease, say polio, in a country where they've not had polio or they've never had polio, right? Are we going to have an outbreak of maybe HIV in a certain country based on lifestyle, for instance? We can start to talk about, okay, if we're going to have maybe a spread or an outbreak of HIV/AIDS in some countries. So based on different predictive models, so advices, recommendations can be provided to policymakers. There was a time they were sharing condom in universities. It doesn't necessarily mean that a certain organization have free money and they just feel they should give people. So probably data were collected that, okay, young people are becoming more sexually active. If they have become more sexually active, are we likely to have, or is there a correlation or a relationship between that and maybe the spread of HIV/AIDS, right? So they build predictive models and they begin to say that, okay, if a single patient is HIV positive, this person is sexually active, transmit to another partner, and this begin to spread. Within 3 months in Nigeria, what is the outbreak of HIV is going to be like? Now, to prevent that, they will begin to put measures in place. They begin to probably give condoms, begin to make some of these drugs free, begin to do sensitization, begin to carry out, begin to use jingle to just sensitize people about this likely outbreak, about the disease. So this was really used during Ebola. And Ebola is something that I've really studied. I've really checked a lot of data points, I've played a lot of data set, and I must give kudos to healthcare practitioners. Data really play a very, 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 very crucial role in curbing the spread of Ebola. And they were even able to use predictive model to say that, okay, we've had Ebola in Nigeria. Then based on this, that geographical data, proximity to Nigeria's countries that are within our borders, then they can predict that in 3 months, if there's Ebola in Nigeria, then Ghana should have their first case. And Ghana can begin to put measures in place to prevent the spread of Ebola. So prediction of outbreak is likely one of the biggest applications or one of the biggest advantages of data in healthcare. Are we still together? Please say hi
Yeah,
if we're together.
Yes, sir, we are
Thank you.
together.
Following.
Okay, so I find the next point very, 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 very interesting. So this next point is it's something that is very prevalent in this part of the world. So medicine use and abuse. Oh, this is huge. If we have to do a study on medicine use, Nigeria is likely to be one of the biggest abusers of substances and of medicine in the world. So I think my definition of drug abuse is taking anything without a prescription by a medical practitioner, right? I don't know if I'm right or correct, but that is what I think drug abuse is all about. You are taking something without prescription by a medical practitioner. It's not backed by data, it's not backed by recommendation. So this is something that is so prevalent globally, and only through the use of data can we really understand the extent of drug abuse. Say stuff like tramadol, stuff like codeine, stuff like tutolin, right? All of this stuff are being abused. They are medicine to treat certain conditions and ailments, either for cough, some are for cough, some are cough syrups, for instance. Some are painkillers, for instance. So all of these, some are pain relievers. So some of these substances, a lot of these substances are being abused. Cannabis, marijuana, all of this stuff are being abused. Alcohol is being abused, right? Paracetamol, Panadol. So most of this stuff, they are being abused. But how do we know? Beyond just talking about it, that, okay, people are using tramadol. Using tramadol for what? To what extent? Where? Who are these people? Why are they using it? What reaction do they get from taking an overdose of tramadol? Then what is the health implication of this abuse, of these substances on their health? Say 10 years down the line, 20 years down the line, on their lungs, on their vital organs, on their sight, on their lifestyle, on their responsiveness, and other stuff. So only data can help us measure, only data can help us address some of these issues. And of course, if we begin to use that to ask the question of, okay, why are these people even taking tramadol? Could there be other underlying issues like depression? Could there be psychological issues? Could there be maybe trauma? Like, why are they really abusing this certain medication? Why this and why not that? So who are these people? Are they teenagers? Are they married people? Are they people within a certain age group, 30 to 50? Are they people within a certain age group of maybe 16 to 32, 16 to 35? So with data, we can answer most of these questions. We can know some of these medications or some of these drugs that have been abused. And based on that, we can begin to maybe even as medical practitioners, right, begin to regulate how we prescribe some of these medicine to people. And when we even use data, we can find out that, okay, this certain medication is addictive. say tutolin, say codeine, say tramadol, for instance. If you know that, okay, this thing is addictive, has a dose of maybe caffeine, has a dose of some of these very, very, very strong narcotic substances, then it can influence your decision. It can influence your prescription as a medical practitioner that, okay, certain or A, B, C is addictive, and data has shown that people between the age of maybe 16 and 25 or 35, they tend to abuse this stuff. So when prescribing for patients that fall into that age group, then rather than prescribe that, you can give something else to just curb the abuse of substance. You don't want your patient to get addicted to a certain substance. And there are people that have taken medications, and because of the way they react to it, even after those conditions are over, right? There are people that can't get off painkiller. Whenever they can't, or pain reliever or painkiller, when they can't sleep, they just administer it because they've taken it in the past. So when data is being collected from patients, when clinical data are being collected about certain prescription, about medications, about the patient's use during their treatment, after their treatment, then a more informed decision can be made by healthcare practitioners. And of course, based on this data, other predictions can be made, like life expectancy, probability of falling sick, probability of organ failure. If you know the rate of maybe the rate at which people are consuming alcohol in a location or within a certain demographic, we can use that to predict life expectancy. We can use that to predict maybe people that the number of people, or the ratio of people that will have diabetes. We can use that to predict how that might even, or the consumption of alcohol can even bring out some conditions, can trigger some other conditions, right, in your patients. And of course, using data, we can begin to develop measures on how do we curb it, how do we reduce it, how do we reduce the spread of ABC. Policymakers can begin to ban certain medication. I learned there was time tramadol was banned, or tramadol is banned in some part of the country, and there is a limit to what can be imported and all of those stuff. So this is one major area that data and healthcare also have a convergence. Medicine can be used for medical purposes and the likes, but these stuffs are being abused. These stuff, even people use them to do a lot of things, right? I read a story on social media a few days ago about 2 people or 3 people at the club that were looking for what they used to take to get high, but they couldn't find. Then they broke paracetamol. Only God knows how many sachets, and they pour alcohol on it and they drank, right? So according to the post, it was too much for their liver to handle, and 3 of them eventually passed away. If we're having recurrent cases of stuff like that, can the government, can healthcare policymakers, can there be a regulation about how people can access paracetamol? Can this medicine, should it be sold over the counter? There are some medications that if you go and look for them, they are going to ask you for medical prescription. Who ask you to come and buy it? So medicine use, drug abuse, substance abuse is one major way that data has a marriage with healthcare. If we're still together, just say hi on the group. So I'm moving to the last point. So there are a lot of ways, a whole lot of ways, and it starts from diagnosis. So, but I didn't talk about that because that is obvious. So to medical practitioners, diagnosis is very, very obvious. When you're diagnosing a patient, you are basically collecting data, or you are checking if this is equals to this, if the blood is within a certain range. If you are doing a wider test, for example, there are things you're looking for. You represent those results in number. If it's higher than this, then it might mean this. If it's lower than this, it might mean this person has typhoid or has malaria or has this or has that, right? So the last point I have on my presentation is management and administration in healthcare. We've been talking about the scientific and this and this. So, but there's a management and administrative aspect of healthcare that to a very large extent determine every other thing, right? It influences the quality of research. It influences the amount dedicated to research and development. It influences the time, the resources, it influences the quality of care received by patients. It influences the welfare of healthcare practitioner, right? So management and administration is a very crucial aspect of healthcare. Is a very, 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 very crucial aspect of healthcare. Nearly all the public hospitals I've been to, at every time I'd always seen vote to the social person for CMD or for something, or we have a new CMD, we have head of this, we have patron, we have this, we have that, right? And to a good extent, the management aspect really determines what happened in that hospital. The management aspect determines the level of care that patients are able to get in a certain hospital or clinic, right? Management also influences the welfare of healthcare practitioners. So we've had issues of people protesting, healthcare practitioners protesting against the harsh work environment. No, during COVID, there were no PPE was provided, no protective gear, no this, no that, no this, right? Now, beyond all this agitation, what if we bring data to healthcare management and administration? What if we bring data to basic thing of like how long does a patient have to wait before he or she is able to see a doctor? And how does that impact that patient satisfaction or the quality of care? What if we begin to look at data of the number of patients that dies because there is no bed space? What if we begin to look at the ratio of doctors, of medical practitioners to patients, and how that impacts the performance of those medical practitioners? If I'm a medical doctor and every day I have to see maybe 300 patients, 7 days a week, I'm definitely going to be worn out. I'm definitely going to be rude and picky and cranky to my patient at a point, right? How about we begin to look at the welfare of this medical practitioner? How about we collect data? What's the average size of the office of a doctor? How many people are sharing an office space? How does that affect their performance? What is their allowance like? Is there hazard allowance because of their exposure during maybe serious issues like the COVID-19 pandemic? How does that influence their performance? Overall, can we collect data about the satisfaction of maybe medical practitioners in Nigeria or those practicing in Nigeria, right? And how does that influence either their decision to work in Nigeria or their decisions to relocate to another country? So all of these data, to a very good extent, when applied to management and administration, we can use it overall and collectively to improve quality of care, to improve access to healthcare. We can use it to improve the welfare and performance of medical practitioners. We can begin to even talk about things like the clustering. And sometimes it's not even just access to fund. It's not even just the amount of funding. If you collect data will show you a lot of things that you probably didn't even think or didn't even believe what was the case. For instance, if you go to some federal medical centers, that is probably all you can do for that day. If you have an appointment at a clinic, especially public hospitals, that is probably all you will do for that day. And I can tell you from data that there are a lot of patients that they feel like their condition is not so life-threatening. And when they are supposed to go for appointments, because of their experience, they know I have to travel probably only God knows how many kilometers. Say I'm living, maybe I'm going to maybe an hospital in Bagada, or I'm in Akure, I have to go to FMC in Owo. And I know that if I go to Owo, for instance, for the whole of that day, I can't do anything. I can't do anything. So it discourages patients from even going for their clinic appointments. Then it begins to pile up. It begins to pile up when they're supposed to be checked and examined and advised and prescriptions given. They don't even show up at all, right? And we begin to have serious cases. We begin to have more people, more patients, and we begin to even have the need for intensive care on the long run. And of course, again, on the part of medical practitioners, data can be used to to improve their satisfaction and performance. How about we do shifting? How about instead of one doctor attending to 200 patients per day, 5 days a week, how about we hire more healthcare practitioners, right? How about we implement things like telemedicine? Do all the patients even need to come to the office? The 200 people, do they even need to see the doctor in the first place? Can we provide information? Can we disseminate maybe basic first aid? Can there be sensitization? Can we decluster the number of people that even need to see the doctor? To be honest with you, a medical practitioner will confirm this. It's not all the patients that they see every day that really need to see a doctor. These people, medical practitioners, spend most of their time talking, giving advice to patients. A patient that is having maybe diabetes, for instance, does not even know that alcohol is not good for him or her. And that person is having maybe certain reactions in his or her body, and that person wants to see the doctor. And all this person needs to do, right, is just stop alcohol. But we don't have data. Why are people going to see the patient? How long do they wait? How long before they leave? What are their complaints? What's the aftermath? Do people even stick to their prescription? So is there a record for this thing? Is there a way to collect this data? After we collect this data, is there a way to analyze? Is there a way to interpret? Is there a way to integrate the insight into the medical processes? So these are some of the ways that we have a convergence between data and healthcare. So there's always the question of, should all healthcare professionals, should we make them data analysts? Should we make them data this or data that, right? No, rather than making them data analysts, data scientists, data this and data that, we always have a campaign of these people, specifically in healthcare now, or in certain industry or certain organization. Data is a way of thinking. When you integrate data thinking into whatever you're doing, your first point of contact is to use data. As a medical professionals, you are thinking data. How can you collect data? What data can you collect? What data can you use? Is my prescription based? Is it backed by data? Is it backed by sentiment? Is it backed by this and backed by that, right? So there's also the place of knowing, as a medical practitioner, knowing how to do basic analytics. And this is even more important for certain roles, say lab technicians, different roles within the medical profession. Knowing how to collect data, knowing how to keep data, knowing how to document data, right? When somebody's vital is maybe raised in decimal places, do you just write 7 instead of 7.9, instead of 7.95, for instance? So then how do you even make sense of this data as a medical practitioner? So there are simple tools like Excel. There are simple tools that can be used to just crunch data. It doesn't even have to be something technical, or it can be just something descriptive. How many patients visited me this week? 200. How many are male? How many are female? What were recurrent? What am I treating the most, for instance? What complaint are people having? There's a certain time that a lot of people are complaining about headache, are complaining about this. If you are looking at those data as a medical practitioner, it's even going to help your practice. It's going to help your preparedness for your clinic appointments. So these are just some of the few ways, some of the few convergence that we have between data and healthcare. So it's an ongoing conversation. It never ends. It never stops, right? And there are even more technical ways like development of medical equipment. A lot of data goes into this thing. Development of innovative, of IoT, of technology based, of trackers, of medical wearables, of different devices that can be used to track and monitor. So I just feel like those are more technical. Those are even going beyond the scope of a medical practitioners to maybe data professionals, engineers, and stuff like that. So I'm going to put a stop to my point and open the floor to more conversation. So that will be all from me. We should have questions, we should have comments, we should have reactions.
Thank you so much, Mr. Adeyemo. Thank you so much. This is a powerful and electrifying presentation on the convergence between data and healthcare. I believe we've not wasted our time by participating in this webinar. Yes, it's still on. And now we'll be opening the floor for questions. We'll be opening the floor for questions. Is there anyone that has questions? Please, you can just, if you can ask by unmuting yourself, or you can just drop your question on the chat platform. You can just drop your questions on the chat platform, please. Questions. We have 1 to 2 minutes to do that. If you have any question, you can just wave or drop your question on the chat platform, please.
Okay, is there any difference between artificial intelligence and data science? Yes, there is a difference. Artificial intelligence is quite different, but artificial intelligence is powered by data, right? Please, can you hear me?
Yes, please, we can hear you, sir.
Okay, so is there a difference? Yes, data science is simply the science of collecting data, cleaning data, analyzing data, using data to predict, or to make decisions. Artificial intelligence, on the other hand, is using machine to mimic the intelligence of a human being. What would you have done in this situation? But a machine is doing it. What would I have done? How do I move this from here? Then we are using machine in this case now to mimic it. So artificial intelligence is different from data science, but artificial intelligence is powered by data. It's powered by data science.
All right, thank you so much, sir. I have a question, sir.
Okay.
All right. When we bring up the concept of data science, and artificial intelligence, robotics into healthcare, there is this popular opinion that there's always a question that is it that robots are going to replace healthcare professional? Are robots going to replace doctors? Are robots going to replace nurses? So can you please help us answer this question? Is it truly that when we begin to implement all these digital health solutions, the robotics, and applying data science in innovating machines and things that can help us, is it true, or is it likely that these technological tools are going to completely replace healthcare professionals, sir?
Okay, so I would say this is a bit of it's quite of a sentimental answer, and everybody have an opinion about this, but there is no direct, actual, absolute answer to this, right? So things like robotics, things like this, are they going to completely replace? Personally, I don't think so, because healthcare is something that would always be needed. And world population continue to explode. Nigeria is currently over 200 million, right? Access to healthcare, especially in remote places, in rural areas, is even still much of a challenge. Now, these places don't even have the technology, they don't have the infrastructure to even power some of these technologies. So most of these technologies are even just good on paper, right? The implementation is still not, we don't have a lot of infrastructure to even implement some of them. So, but let's now assume that by whatever means, with technologies like 5G, for instance, we are able to implement them. I don't honestly think we can implement them at scale, right? How many hospitals in Nigeria can really afford to have robots conducting surgery? The number will be very, 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 very small. And if the number is small, of course, medical practitioners will always be in need. That is one scenario. So on the other hand, say if with 5G, for instance, a doctor can or a surgeon can stay in his or her house, or can even be in another country and carry out a procedure on a patient, for instance, right? So the robot might be able to do that, might be able to carry out the procedure. But at the end of the day, a robot is a robot. A robot is a machine. The aspect of giving care, the aspect of providing other cares like administration of prescription, of medical advice, of counseling, right, of nutrition, prescription, and all those stuff. They can't be replaced by machine. Robots are robots at the end of the day. So of course, if by whatever means, again, we're able to flood all our hospitals with robots, we are able to implement them, we are able to, everywhere is just, every hospital can afford to do that. There's also the ethical concerns. When something goes wrong, for instance, who do we hold accountable? Can the robots provide maybe specialized advice to patients? Now that's the difference between a machine and a human being. A human being can give advice to patient A with this condition and give another advice to patient B with the same condition based on intuition, based on experience, based on data, based on a lot of things. So to a very good extent, we can't outrightly, or I don't foresee that somewhere in the future or sometime in the future, we are going to get to that point where machines are outrightly going to replace human being. And again, there's also this thing, some of these machines we call them expert system. Expert system is programming the knowledge that somebody has acquired. You are programming it inside the system such that if that person dies, the system can use all the information you've stored in it to provide prescriptions and medical advice like that person would have done, right? So if we send all the medical practitioners away, who is going to provide the information, the knowledge base that the expert systems are going to run on? So at the end of the day, I foresee more like a sort of collaboration between humans and robots and machines. The need for healthcare will continue to be explosive, especially if world population continue to grow. And again, who is going to be conducting the research? Every medical practitioner is doing one kind of research or another. And I'm also aware that there are exams you have to write for you to get some certain cadre. You have to do publications, do all of these things, contribute to medical knowledge, write journals and the likes. So we can't get robots to do all of this. And so the best we can do, or the best we can have for now, is to use the current medical knowledge, current medical findings from studies, then use all of those things to develop our robot. So, but that's not the end of it. If we're doing predictions about the outbreaks, the pandemics of the future, we need to create vaccines for them. Human beings have to do those studies. These humans are scientists, they are medical practitioners, right? Somebody has to do the clinical trial. Somebody has to do the pilot. Somebody has to administer to patients. Somebody has to get the feedback. Somebody now has to put all those things into a machine. So more or less, we're going to be having a synergy, a collaboration between human and machines, or humans and robots, to deliver healthcare. Then another opportunity that I think is going to open up is tech in healthcare. Somebody will program those machines, and those people can be programmers, but they will be programmers that have a lot of domain knowledge in medicine, that have a lot of domain knowledge in chemistry, people that are insiders, medical practitioners, not computer programmers or somebody that can code and the like. So I don't see that extinction. I don't think at any point we're going to get to that part where machines absolutely replace medical professionals. So, but of course, like I said, that is just my own opinion, right? It is subject to change, or people are definitely going to have maybe counter opinion. So, but with the current knowledge I have, with the current level of study and research that I've done, some of these technologies we are talking about, some of them are not even implementable in the next 50 years. Some of them are implementable, but they are not implementable at scale. Some of them are implementable at scale, but there are no infrastructures to even power them. especially more than half of the world is not connected to the internet, more than half. So if we're having that figure, and internet is going to power most of these technologies, robots, and very strong internet, not 4G, not even 5G in some cases, right? So we begin to have questions of these things are good on paper, these things are applicable on paper. Can they really, really be implemented? And when they're implemented, can they be implemented as skill? If they're implemented as skills, is this something that we can actually, is this something that we can even have everywhere? Is it something that's commercially viable? So until all of those things are answered positively, I really don't think there's a threat by machines on medical professionals. I don't know if that gives some kind of answer to your question.
Yes, sir. Very well, sir. Thank you so much for the comprehensive and detailed answer.
You're welcome. So somebody's asking how can healthcare professionals who are interested in becoming data professionals take the step? So like any other thing that you want to become, you have to start by learning, right? So the first step is for healthcare professionals to probably take courses on data-driven decision making, take courses on data analytics, take courses on specific courses or specialized courses on data for healthcare. So that is the first step. So the second step is now begin to implement what they learn in those courses. So those are the two major things that need to be done actually. Learn or take courses on data analytics, data science, modeling, and the likes. And of course, you can even get specialized courses because data is broad, to be honest. So you can get courses on data for healthcare. So as an organization, we launched the platform yesterday where people can access data knowledge from anywhere in the world. So the platform is ZACRAClearning.com. I'll put it on the group now. So we are creating more content, specialized content, generalized content for people that want to learn data science, people that want to become data professionals and the likes. So that is the first step, in my opinion. Acquire the data skills. Then second step, begin to implement data into your practice, whatever your practice might be. So you can check out our platform. We're loading more courses. So, but that is definitely the first step. So do we have more questions, please?
All right. Thank you so much, Mr. Wale.
Pleasure's mine.
So, all right. I think okay. Any more question? I don't think we have more questions from now, sir.
All right, that's lovely.
Okay. Oh, all right. Thank you so much. So as we are wrapping up, I would like to invite the CEO of CareCode's Digital Health Hub. So he has some things to tell us and to cap up this meeting. So Mr. Ina Daniel, you're welcome, sir. We can have you now, sir.
All right, thank you so much. I'm really excited. I never knew Mr. Wale was going to do so much justice to the topic. He talked as if he's a doctor or a nurse or something.
I wish I were.
I'm really serious. I was glued to the screen. I couldn't do any other thing. I really enjoyed it. And from what we have seen, we can see that there is potential in the healthcare field, especially in the health technology field. One thing that CareCode has come to do in Nigeria and Africa is actually very unique because we don't really have digital health hubs in Nigeria that are dedicated to exposing healthcare professionals, nurses, doctors, pharmacists, realities of digital life. And this is what we are trying to do. And this webinar is one that will pave way for future webinars. So I would like to still honor the presence of Mrs. Apolline Lobo. She's the nurse educator in Evercare Hospital Lekki. I'm also amazed and honored that she stayed throughout the webinar. Thank you so much, ma'am. And we also have Mrs. Ileye Oyebusola, the founder of the Congenital Heart Disease Foundation of Nigeria, a non-profit organization in Nigeria dedicated to fighting for what they call heart warriors, children who are suffering from congenital heart defects. They are a very, very dear partner, CareCity. We are seeing more prospects in that aspect. And also, I want to also let you know that anyone who's interested in taking any of ZACRAC's courses on digital health, on data science, we will make room for certain discounts for them from those who come directly from CareCity as CareCode. So if you're interested, you can just send us a message and we'll see how we can help you transition from being just a healthcare professional to a health tech professional. You know, it's amazing. And in the future, we are also planning on designing tailored fit courses on digital health for Nigeria and Africa, because look at it, we don't really have this kind of courses, you know, don't really have this kind of courses around. Yeah. So like we all know what ZACRAC is into. Yeah, a data analytics company, and they are into data analysis and stuff like that. So if you have anything you want to do that concerns data analytics, feel free to reach out to them, professionals in their field. So at the end of this meeting, we have to send certificates of participation to every participant who have taken time out to be part of this program. And then we also have space for those who want to become core members of CareCode, get access to mentorship, get access to innovative materials, get access to free webinars, get access to the community that is interested in your growth in the tech industry in Africa. And also, we will also like to let you know that in the coming future, we'll be having a digital health summit, be the first of its kind in Nigeria. Yes, and ZACRAC will be a major partner in that worldwide program. So we'll keep in touch, and if we have more information, we'll communicate to you through our social media, through our website, and other means of communication. So I hand over the platform back to the moderator, Mr. Elmi Oluwatu. Thank you.
Thank you so much, the CEO, CareCode Digital Health Hub. Thank you so much for that wonderful advice to everyone, to every participant tonight. So we've come to the end of this great webinar. I believe everyone has learned something new, added to your knowledge, and I know that tonight's teaching is a call to action for many of us. It's a call to action. We need to start thinking data, start acting data. We need to, in a bid to make difference in our medical practices, in our clinical practices, we need to, implement analytical reasoning, not just decision based on emotion, decisions based on sentiment. Mr. Wale has done justice to that, and he has made us see reasons why we need to, implement the usage of data analytics, the knowledge of data to improve our clinical practices and improve the condition of living and healing of our patients. So I would like to reiterate a few announcements. We urge everyone to please look into, okay, we sent a DM here on the chat platform. Please just forward your name and your email address to receive your certificate of participation. Also, I'll be sending a feedback link here. We want you to please help us fill this form as a form of feedback for us, so as to know how to serve better next time and then improve on this webinar. also, there is a link on the chat platform as well, the ZACRAC Learning. It has some ample number of courses where you can take to improve your data analytics skills. And as the CEO CareCo Digital Health Hub has rightly said, in the nearest future, a few months to this time, we'll be having our Digital Health Summit, the first of its kind in Nigeria, Digital Health Summit. So this is just to get you prepared and be ready to participate. So I would like to thank everyone for coming tonight, for making yourself available. You mean a lot to us. We sincerely appreciate your presence, our special guest, the speaker, the host, and every other person here present. So I would like to draw the curtain of tonight's meeting. I would like to draw the curtain of tonight's meeting. But before going, I would like us to take a selfie, although it's night, but let's just take a selfie. There's a way to do that. Let's just take a selfie. You can just open your camera. If you want us to see you, you can put on your camera just for documentation purpose. You can open your camera. All right, are we ready for this selfie? Okay, Mr. Wale Adeyemo, I can see you. Mr. Ayinla Daniel. All right. Can just take a screenshot, just a screenshot. All right, thank you so much, everyone. Also, we are going to have a recording of this webinar also in our email, the one we've dropped. The PowerPoint presentation will be sent to us in line with the certificate of participation as well. So please, if you've not dropped your email address and your full name, please endeavor to do that. So once again, I say thank you so much, everyone, for coming. Thank you so much. And have a wonderful night's rest. I remain Adewumi Oluwatobiloba Theophilus, your host for tonight, the moderator of the event. Thank you so much once again. And good night.
Pleasure to be here. Good night.
Thank you. Good night.